Right now, there's a piece of metal inside millions of jaws that's slowly dissolving, corroding, rusting, possibly in your own mouth, releasing particles into their bone, triggering inflammation, chronic inflammation, and 1 out of every 3 patients is destroying the very bone that's supposed to hold it into place. I personally placed these implants for years, thousands of them, until I found a 9-year study that stopped me cold. 0 cases of this bone-destroying disease, not one. After reading that study, I thought, why am I still putting metal into people's mouths when there is a way better alternative that has like 0 side effects? To make a very long story short, I became a KOL, key opinion leader, speaker, educator for this type of new implant. And I taught other dentists how to use it because everybody needs to know about this. I myself had that exact implant placed into my own mouth when I had my root canal tooth removed. I'm Dr. Chris, the detox dentist, here to unlimit your health, starting in the mouth. Now, today I'm going to show you 5 reasons why this specific implant should be illegal and what I use instead exclusively. And on top of that, I'm going to show you how to know if your implant is already corroding inside your jaw right now. Now, I've been doing this for over 27 years. I'm AACD accredited in 2007, and I need to tell you something that most dentists won't. Golden standard implant, right? The one 95% of dentists use, that one that I even used to use, has a dirty little secret. It's not stable. It's not inert. And the science proving this has been piling up for years, while the industry pretends it doesn't exist. Follow me through this video. By the end, you'll know exactly what's happening inside that titanium implant. Actually, around the titanium implant, and why 80% of patients say they choose the alternative if given the option. And the one test that can tell you if your body is reacting to the metal in your mouth. Now, there's also something I'm working on that connects all of this to your energy, your inflammation, and your ability to actually heal. I'll tell you about it at the end. Here's what they told us in dental school. Titanium is biocompatible. It forms an oxide layer around the outside. Your body accepts it. This sounds great, but it's incomplete. What they failed to tell you is that the oxide layer breaks down or is broken down. Every time you chew, every time you brush, every time your hygienist cleans around that implant with an ultrasonic scaler, a metal tool, an acid, fluoride, things like that are going to break down that protective oxide layer around your titanium implant that makes it biocompatible. Now, a 2017 study, not that long ago, in Scientific Reports found that ultrasonic scaling releases millions of titanium particles directly into your tissue. Not thousands, millions. That little ultrasonic cleaner your hygienist uses is bubbling up all the bad titanium parts around your implants. Those particles, they don't just sit there. Your immune system sees them as invaders. Macrophages, your cleanup cells, swallow them up and basically choke on them. They can't digest metal. So what do? Well, they ask for backup. Let's add more. They release inflammatory signals. There's all kinds like TNF alpha, interleukin 1, interleukin 6. They just create a big storm. Something major is going on. We need help. The sad thing is, nobody can help. Now, if these inflammatory markers sound familiar, they kind of should. They're the same cytokines elevated in autoimmune disease, chronic fatigue, and long-haul inflammatory conditions, right? The things that make you tired, exhausted, your joints hurt. This is the stuff most of us have or will deal with. So what does that mean for you? Well, your implant isn't just sitting in your jaw. It's triggering a low-grade, constant immune war 24/7 for years, probably forever. And that leads directly to the next problem. Let's get a little bit more specific. There is a disease called peri-implantitis. Very simple. Peri-implantitis infection. Fancy word, simple meaning, your bone is dissolving around your implant. It starts with inflammation, then it progresses to infection, and it ends with the implant falling out, if you're lucky, or it needs to be cut out, which is a whole different type of procedure. Not so exciting. So how common is this, right? Well, let's look at a 2022 meta-analysis looking at this across 57 studies. A lot of studies. The number, 34% of patients with titanium implants develop peri-implantitis. That's 1 in 3 of you will develop peri-implantitis if you have a titanium implant. That's a terrible statistic. You literally paid $3,000 to $6,000 for that implant. You went through surgery. You waited for months to heal, okay? And you have a 1 in 3 chance of your body attacking it and causing way worse problems through chronic inflammation. Doesn't sound like a good deal to me. Now, here's the statistics that should make you angry. A 9-year study out of the Heinrich-Heine University in Germany followed patients with ceramic or zirconia implants. Same design, same location, same follow-up protocol, the white implant, right? The peri-implantitis cases over 9 years, 0. Not a single case. A big fat 0. Why isn't every dentist offering this? Well, we'll get there. But first, you need to understand what's happening at the cellular level. Here's the question nobody asks before getting an implant. Is your immune system going to accept this material? With titanium, the answer is maybe. A clinical study of 1,500 implants found that 0.6% had a full-blown allergic reaction to titanium. That's 1 in 166 patients. That's a very scary scenario. Doesn't sound like a lot at first, but until you realize there are 5 million dental implants placed every single year, that's 30,000 patients, people who annually have allergic reactions to something permanently screwed into their skull. But allergy is just the obvious reaction. What about all the other patients, the ones who aren't technically allergic, but whose bodies are constantly fighting the metal? A much more recent study, 2024, in the International Journal of Implant Dentistry, put it pretty bluntly, titanium particles induce type 1 and type 4 hypersensitivity reactions. What does that mean? Well, they cause osteolysis, bone destruction, and this, of course, increases your odds of implant failure. Your bone is being destroyed. It's probably going to be a failure. Hopefully, otherwise we have to cut it out. Now, how about zirconia? Well, it's a ceramic. It's chemically inert. No corrosion, no ion release. It's an entire implant made out of that layer that's around titanium that's supposed to be biocompatible. But you don't have a layer, you have an entire implant. And studies show that this works way better. Much lower inflammatory infiltrate around the implants, okay, compared to titanium. Your immune system doesn't attack it because there's nothing to attack. It actually likes the zirconia. Tissue loves the zirconia. I've had a whole bunch of patients come to me who've had low-grade sinus pressure around that area where the implant was, right? The titanium implant. Fatigue, they couldn't explain. Doctors found nothing. The x-ray said the implant was fine. Only a few threads were exposed. That's how they classify success. Only a little failure means success, right? Ridiculous. After years of this, they come to see me and I look at it. I'm like, well, according to the literature, it's a successful titanium implant. But I can tell you, out of experience, that doesn't look like success to me. The patients are given the options and most of them choose to remove the implant, which isn't always the easiest procedure. But historically speaking, in my practice, that has resulted in resolution of those problems, okay? What do we do instead? Well, we place a zirconia implant after healing or immediately if we can, and the symptoms don't come back. Now, zirconia isn't a miracle substance. It's not a miracle product, and I've had patients react to zirconia. I mean, very, very, very few. As a matter of fact, I can only remember one, but it is a material in your jaw, but it's certainly dramatically more successful than anything I've seen with titanium. Does this mean that everybody who has a titanium implant should have it removed? Absolutely not. Most of them are going to be fine, and they're just a really big pain to remove anyhow. But if you start to develop problems with it, then yeah, have that looked at. Plus, you have to treat it differently. Titanium has to be carefully managed. You can't scratch it. You have to make sure the implant is not damaged, or this will become a problem. Now, here is the uncomfortable truth. 80% of patients, when surveyed, say they would prefer a ceramic implant over metal. They want metal-free. They don't want mercury fillings. They don't want gold fillings. They want metal-free, ceramic for many reasons, right? They want biocompatible. They want what makes sense. You would pick it probably as well, but they're not given the option. So why do 95% of dentists still place titanium? I can come up with 3 reasons. Number 1, training. Dental schools teach titanium. That's what we learn. That's what we practice on. Zirconia is slightly different. Different to dentists always means scary. New instruments, different techniques. Nobody wants to try something new if they have something that theoretically works. Number 2 is cost. Now, zirconia implants cost more for the dentist. I don't charge more than I would have charged for a titanium implant, but some dentists don't want to spend the extra money buying zirconia implants because they make less money, right? The components just cost more. It's simple economics. Number 3 is liability, which is actually a double-edged sword. Titanium has over 50 years of documentation. Zirconia, maybe 15 or more, okay? Even though the outcomes are better, some dentists won't touch anything without decades of data. But if there is a different option out there that has better results, as we've just proved with all the studies, isn't it legally required that the dentist offers the patients both options? I've argued when I was speaking as a KOL that not offering zirconia implants is a liability, because if the patient finds out they could have had something with almost zero peri-implantitis and zero peri-mucositis, and you didn't offer that, you might be legally liable for anything that's going to happen with that titanium implant. Just saying. Anyhow, the end result is the patients don't even get offered the choice. The dentist doesn't know, doesn't want to know, doesn't want to spend the money, so the patient never finds out. They walk in, they're told they need an implant, they get titanium. No discussion of materials, no informed consent about corrosion, particle release, or peri-implantitis, peri-mucositis, none of that. It's just an implant. In my opinion, that is not healthcare. That's an assembly line. That's what, unfortunately, a lot of dental practices have turned into, a money-making machine. Now, I chose the zirconia implant in my mouth for the health aspects. But if this was a front tooth implant, there's one thing we didn't even talk about. The zirconia implant is white. It doesn't have that gray shine through by the tissue. If you've seen people with titanium implants on the front teeth, often their gums are all dark, almost black at times. That's because you can see the black implant through, and the tissue doesn't like the implant, so there's a lot less blood flow around that implant. With the zirconia implant, there's a lot of blood flow, almost identical to natural teeth, and it's white, so you get a beautiful pink tissue. Way better aesthetically. So where does that leave you? If you're considering an implant, ask your dentist about zirconia implants. Do you offer ceramic implants? If they look at you like a deer in the headlights, run, because they don't have all the options. Ceramic implants are not experimental. It's been FDA approved since 2011. Not that that means that much, but it has been. In the United States, it's fairly new. In Europe, they've been doing this for decades. The research is there. The outcomes are way better. Now, if you already have a titanium implant, don't panic, okay? Not everyone reacts, but if you have some unexplained inflammation in your body, you have fatigue, chronic fatigue, some sort of autoimmune disease that's not getting better, the site around the implant is always inflamed, bleeding, or just doesn't look right, get it checked out, get it tested by a biologic dentist, somebody who knows about zirconia. You could also take a Melissa test, a lymphocyte transformation test, which tests for metal sensitivity. It can tell you if you're reacting to the metal. I personally would also get an HSCRP test. That's a high sensitivity C-reactive protein. Simply put, it measures the systemic inflammation. How much inflammation does your body have? If it's elevated and you can't figure out why, your mouth might be the source. In my experience, it often is the source, and that's where we start with my protocols, the Alpha Sapien protocol. Now, if you're dealing with peri-implantitis right now, and that would be pretty obvious, any dentist can see that, this is serious. This is no joke. This is something you need to address. That bone loss doesn't reverse on its own. It doesn't go away. It continues to get worse. And it's chronic inflammation. Chronic inflammation, in my opinion, is the root cause of nearly all disease. You need to see a biologic dentist, ASAP, who fully understands the full picture. not just the implant, but your immune system, okay? Your inflammatory levels, your whole body health. Another very important lesson I've learned after 27 years, your mouth is not separate from your body. It's not dental insurance and health insurance. It's all one thing. As a matter of fact, this is where a lot of the disease starts. Health and disease start in the mouth, in my opinion. Now, what's in your jaw affects your gut, your energy, your immune system, your ability to heal. You got to start there. Now, I don't want to tell you that titanium implants are evil. They were great for many years. We really didn't have any other choices, and it was a really good solution. But we have better options now, okay? Options that are inert, that don't cause this chronic inflammation. And for too many patients, these titanium implants are a source of chronic, invisible stress that just never gets identified. I personally think that zirconia has changed the game, and dentists need to get on board and learn all the options for their patients. Now, if you're watching this and you're thinking my problems are way bigger than just this one implant, you're probably right. Implants are just one piece of the puzzle. There's metal in your mouth, there's old root canals, there's toxins in your food, there's inflammation from your environment, EMF, stress, how you just manage your day to day. There's so many things that are affecting your health. It's literally never ending. You need a quarterback of health. If this sounds familiar, then I built something to help people just like you. It's called the Alpha Sapien Protocol, and it takes about 66 days. We test your inflammatory markers at the beginning and then again at the end. In that time between those two tests, we're going to change how you eat, what you eat, some supplements to rebuild your mitochondria, how you move. We're going to check for infections in your mouth, and we're going to have day-to-day changes that are going to gear you towards a healthier way of living. By the end, you're going to be a different person. There's no gimmicks. These are real numbers, real transformations. We're going to test before and after. If there's no change, I'll work with you until there is. I've used this protocol with patients, but I'm going to start it online in February. If you're interested, there's a link in the bio, and if you become a founding member of this new protocol, there's benefits. I'm Dr. Chris, the Detox Dentist, and if this was helpful for you, smash the like button. It helps me understand what kind of videos to make for you.